My name is Joe Paone. I'm the product marketing manager with NeuroStar, and we're pleased today to have with us Shattuck Groom from Cage Point Advertising in New York City. Shattuck helps us design and develop and implement our digital marketing strategies to help us bring our message of TMS and your practice out to the public and your customers and your patients. We also have with us Karen Schaefer. Karen is the account director at the DID agency in the Philadelphia area, and Karen helps us develop our campaign strategies for marketing and advertising. So without further ado, I'll turn it over to Karen and Shattuck, and they'll take us through our webinar.
Hi, everyone. Welcome to today. Welcome, and thank you for having us. We really appreciate your time this afternoon. As we start, I wanted to talk a little bit more about how we prepared for today. When we discussed, the best way to approach our discussion today and a best way to really provide any insights that Shattuck and I have learned over the years, we really kept coming back to some insights, really two key insights that we heard about psychiatrists and their staff. The first that we heard is how hard psychiatrists really work for their patients. And it really led us to think, okay, well, they're working so hard for their patients to make sure their patients are covered, taken care of, follow-ups, everything they could possibly do. How do we make sure that their digital presence is working as hard for them as they are working for their patients? And then second, as we were thinking more of your digital presence and your digital strategy, how do we make sure that knowing, when a patient reaches out, you want to make sure that you are available and that there's the opportunity to connect with them. How do we, how could we find some tips or some additional provide some guidance or insight to help make that access happen? So as you can see for the agenda today, we thought about what are 3 easy steps that we could help to help build an effective digital presence. And then also, when you're building your digital presence, what does your media strategy look like? How could you use social or use advertising to make sure that people are getting to your website or to your social media pages? And then finally, we had some business building tools and assets that we wanted to share to help with this whole process. And I think at the end of today, we're going to follow up with Q&A. So as questions are coming through, Shattuck and I will be able to answer as they come through at the end of the presentation. So going into how to build an effective presence in 3 steps. So the first thing we always look at is design, and I'm sure anytime anyone goes to a web page, you see different things that catch your eye. So when you're building out your web presence, one I think really key and important fact that people sometimes don't really think about is how to make sure that your contact information is upfront and easily accessible. Things like how do I make an appointment, or is there a way to request an appointment through the site, phone number, an address. Sometimes these can get lost in a design when they really should be first and foremost. Don't really discount soft imagery, pictures of people on your site to have that emotional connection with your audience. And then also, especially in today's day and age, responsive design is really a must. About 70% of the US population uses their smartphones. So as you're looking to develop your site, you have to be thinking, okay, if someone's looking at it on a smartphone or if they're looking at it on a tablet, are they going to be able to see my contact information? Are they going to be able to get the information that they need to be able to connect with me? So that's, the soft part of when you're looking at your design, but there's headlines there, there's content that's searchable. And I think when we'll hear a little bit more about Shattuck, we'll talk a little bit more about that content, but making sure that when you're looking at your headlines and what your digital presence, your website looks like, that it correlates with your social media presence so that consistency can help patients recognize you and your brand. So as you're building your site, the second tip that again, Shattuck will talk a little bit more about the importance of building with optimization in mind. But what does that really mean? Optimization, as simple as I could put it, boils down to helping to make sure that when someone is searching you in website rankings or searching for someone in your area in website rankings, that you appear hopefully as high as you can possibly, a higher rank. And it may sound complicated, but there are really simple changes that you could make to your site, especially in the back end, to things called metadata to help with those search engine rankings. So one thing, and you can see it on the slide here, we talk about a meta title and your descriptions and your keywords. For your meta title, think of how a user would search for something in search engine results, keeping the title short and simple, almost the characters of a tweet. In this case, they're usually under about 60 characters for your title. And the description, same kind of concept. Think through the important keywords that people would search for you on the description of your site and the benefits to the visitor. But again, 150 characters, thinking in the same kind of, as short and to the point as you could get, to make sure that if someone's searching you, they'll hopefully use those keywords that you're thinking and pop up to higher rank in the search results. Another thing to consider is your web page titles. The titles on the different pages of your site are searched, and they are searched by search engines that then also used to help improve your ranking. So all that content that you have in there, if you're thinking, how would someone find me? This is a great way to put it into your site, the back end and the front end, so that when people are searching you, they can find you. And then finally, something I think that, thinking back to that insight of when a patient raises their hand, how do we make sure that they find you? How do we make sure that they can get in to get an appointment? And I know there are some sites that you can easily make appointments through. They can connect to your back end, or there are ways to send emails to make appointments. But there are third-party sites out there that you can partner with that would really give your patients easy access. And we find, in off hours that a patient is looking to reach out, they can go into a site like ZocDoc and it'll easily make that appointment and possibly fill open gaps that you may have in your calendar that, may not be great appointment times, but they'll see them, book. And I think when we were at CTMS and talking a little bit about ZocDoc a few months ago, it was great to hear some of the positive reactions that the audience members had, because they felt like patients that actually use sites like this do show up for their appointments. So that was really great to hear. So I'm going to turn it over now to Shattuck to talk more about the media strategy. And when you have your site creative, how do you make sure that people are not only getting there, but that you're continuously improving your site so people can, you're continuously improving your site so that people can reach you. Shattuck?
Thank you, Karen. So what we're going to talk about over the next few minutes is how to create advertising and media campaigns to drive patients to your offices. As you know, you can use advertising in a variety of ways, but the ultimate question is the advertising working, and are we efficiently driving prospective patients to our offices? We'll show you a series of ways of how to do that through Google, through Facebook, and through some other tactics. But most importantly, also talk about how do we measure it and how do we know that the advertising is working? And there are some basic tools out there, most of them are all free, that will tell you if your advertising is working and if you're driving patients efficiently to your offices. As background, the landscape of advertising, you'll see healthcare and pharma are utilizing digital and television, print, radio, outdoor in efficient manners, and it's growing every year. What we're going to talk about is what's affordable and what you, as an office, or what NeuroStar can do to help you drive prospective patients to your site or to your offices. The landscape of digital is growing. As you can see on the chart on the left, consumers and prospective patients are using the internet. 50% of them are using it to learn about their health conditions. 35% of them are using it to learn about available treatments. And so how can we take this information and how can we build a media or an advertising campaign to leverage this information? We know that search is critical to driving information and to getting prospective patients to your site. If you look at some of these stats, we know that 50% of research is done throughout a 2-week period before an appointment is even scheduled. Our ultimate goal through advertising and media is to get patients to schedule an appointment. And if it takes 2 weeks for them to do that, where are they going online? And how can we make sure that we capture these folks and give them the tools to set an appointment? We also know that patients who booked appointments conducted 3 times as many searches And so what this is telling us is you have to make sure that you have your presence on Google search ads. Karen was speaking about what's called organic search, how you can make sure your website is showing up without paying for it. I'll speak to what are the paid ads. Again, what you can see here with these stats is search and the internet is critical for appointment setting. So how do we do that? In our world, we call this a marketing funnel, where advertising and measuring of advertising is going to drive prospective patients to your site. And how can they set an appointment? Right now, what NeuroStar is doing, that is all of our partners, everybody who is on the phone, we're currently working with you and doing that for you. We have something called a physician locator, and then after a consumer or a prospective patient goes to the website and looks for where there's a physician, we are driving those prospective patients to your websites, and we'll show you how that works. So NeuroStar is currently helping their partners, or you can also take these tactics. I'm sure several of you are currently doing this, so it might not be new, but there are new ways to think about of how to make sure it's efficient and how you can get your information properly. So this marketing funnel, on this particular page, what you'll see is different advertising tactics. Google search, Facebook, digital display, radio, or for some of those who have multiple centers, maybe you can use TV. Once we drive advertising, we're asking the patients through either a banner or a search ad to take an action, and usually that action is to go to your website. After they take that action of going to your website, the question we have, in Karen's example of ZocDoc, is, are you permitting them to set an appointment? There are several tools out there that permit you to work with these prospective patients to set an appointment directly off of your website and have them come into your office. The ultimate question again is, are you tracking this? And what we're going to spend some time talking about are the tools out there like Google Analytics, and are you efficiently using them, or are you having your agencies use them, or are you working with NeuroStar to understand exactly how many potential customers or physician locators are being found in your respective markets. So here's a live example of what we're currently doing, what NeuroStar is currently doing. So as you can see, that concept of a funnel on the left, we start with an ad, and this happens to be a text ad that's found on Google search. And if a prospective patient clicks on the text ad, they'll go to the NeuroStar site. Some of you are already doing this and sending prospective patients to your site. So it should follow a very similar stream, where consumers or patients click on the ad, go to the website, and then you'll see on the third picture the physician locator. This is if you go to the NeuroStar site, you'll see that this is actively being used, and we are driving people to this physician locator. After they find an office, they then put their information in so that we could send potential appointments your way. It's a very simple funnel, and you can see how it starts with a simple search ad and ends with an appointment setting vehicle. The question again is, are we studying this and are we measuring if it's working or not? And there are ways to make sure that we know if we're spending investment dollars against search ads and if they're actually driving appointments. And that's what we'll walk through in a few minutes. With respect to advertising prioritization, Karen mentioned the website. You can also build a Facebook page. Those are done by a web developer or maybe somebody internally, or potentially you've hired somebody to do that. With respect to paid advertising, Google search is probably the most efficient tactic you can run. It's the least expensive, and it probably will produce the strongest results, followed by Facebook newsfeed ads, which we will speak to as well, and then banner ads. You can go ahead and there are ways to place banner ads on the internet and get prospective patients to click on them and go to your site. And of course, there's radio and TV, which some of you are using right now as well. So if you're to set up if those of you who have not set up a Google search campaign, it's very intuitive. It's quite easy. Some of you are already doing it with internally or with agencies. But these 6 steps that we've outlined on this page show you how easy it is to set this campaign up. Just go to google.com/AdWords, and it's a very intuitive platform, and we'll tell you exactly what to do. Examples of what it may look like, you can see on this page right here, These are examples of what NeuroStar is doing for their partners. You can see this is a screenshot of examples of keywords, the first one being magnetic treatment for depression, TMS, NeuroStar treatment, and on and on. This is an example of identifying which keyword is driving that physician locator or that appointment. The tool itself, you can see on the top there where it says how much was invested, how many impressions were driven, how many clicks, and then the word conversions, that's a physician locator or an appointment. And if you can identify how much it costs to drive that appointment, you can then, if you're doing this internally or with an agency or NeuroStar, you can then understand exactly what cost efficiencies you can have, which keywords are driving those appointments. And you can see it then becomes a very simple model. For those of you who have agencies or people you're working with to do this, I would ask you to ask them to show you reports that are very similar to this, because they know which keywords are driving the traffic efficiently. For Facebook, very similar to Google, it's a very simple setup process if you haven't done it yet. You can go to facebook.com/pages/create and follow a very, very intuitive process of how to set up your Facebook page and then start advertising. For those of you who aren't doing that or don't have plans, we would recommend that you simply link your accounts to NeuroStar's account. Right now, NeuroStar has a very active Facebook page and very active Facebook campaign. The creative is already produced, people are already engaging with it, and you can leverage their Facebook page by just liking it, and then whoever liked your page from prospective patients or consumers, they will see the same advertising. Example of that page you can see right here on the right-hand side. This is the NeuroStar Facebook page. It's a very active page, and you can see examples of who's engaging with it. Typically, it's 45 to 64-year-old patients. You can see examples of some of the creative that NeuroStar is running on their page. Again, if you like their page, and if you want to promote advertising, it's as simple as just liking their page through your page, and then the consumers will see the same ads. This is just a simple schedule. If you're working externally or internally with somebody who is promoting your Facebook page, you should be getting reports very similar to this that show how many engagements you're getting, how many consumers are speaking, how many consumers are sharing, and what patients really want to know. So again, an example of a report. So how do we tie all of this together? Gave you examples of Google search, of Facebook. There's something called Google Analytics. Again, that's a free tool, and it's just a piece of script or a code that you put on your website. And what it will give you is a full dashboard of who's coming to your site and which advertising vehicles are successfully driving leads or appointments to your office. We'll show you some examples of that in the next couple of pages. On the next page here where it says how to build a Google Analytics report, this is a screenshot of an example. Again, this is a free tool. And in this example, you can see which media tactics are driving those appointments to your page. In this particular example, you can see how paid search ranks very highly. Over 30% of the leads might be coming from paid search. You'll also see Facebook, where in this example, 24% of all the leads came from Facebook. Once you understand which media tactics are driving those leads or appointments, you can optimize your campaign, and that's where the secret sauce exists, and how to invest your dollars, minimize any risk, and make sure that you are driving appointments at the most efficient cost. The tool itself also will tell you who's coming to your website. Are they male? Are they female? What age are they? So the tool goes beyond telling you which tactic worked. It also tells you demographics on who's coming to your site. So to wrap it all up, we started with that funnel. If you remember, we showed you an example of a text ad. When somebody clicks on that text ad, they go to a website. In this example, it's NeuroStar. Once they go to NeuroStar, there's a very easy to understand button to click on, and it will show you where all of the NeuroStar partners are. If you happen to be one of them, then the patient will click on your ad in the NeuroStar site. and then hopefully they will go ahead and ask for an appointment. And you can see that last example here. Sample campaign reports, again, as we spoke about, you can see here in this example, once we have a full media program, an advertising program, you can start to understand which media tactics are driving those appointments. So what I would recommend and what I would ask of all the partners who are on the phone, if you're currently doing something like this, if it's done internally or if it's being done externally through an outside group, we would highly recommend to start asking for reports like this, because you can understand exactly which tactic is driving efficient appointments. NeuroStar has been doing this for quite a while, and you can see some examples of some of the other folks in the landscape on this page. And you can see this is a screenshot of website traffic that's being driven and advertising that's being driven out there in the marketplace. You can see NeuroStar consistently has quite a high volume of traffic. Again, what's being done with that traffic is what we just showed you on that marketing funnel, where we have patients who are coming to the site. Those patients are looking for physicians. Once they find those physicians, they are then setting appointments.
Okay, Shadik's going to hand it back over to me to tell you a little bit more about some of the business building tools and assets. So we're going to freeze the screen really quickly as we switch over to a live site, so I can provide you just a little bit of a demo of some of the tools and assets that NeuroStar customers are available for customers to receive. Just give us a couple seconds here as we shift gears a little bit. Okay, so are we back on? So hopefully everyone can see the screen. So when we started working with NeuroStar, and the company started to dive into ways that they could create a valuable resource to help activate patient interest and to help their physicians grow their practice. And so they developed this website called myneurostar.com, and it's a resource center that includes patient materials, physician communication, different advertising tools, and digital and social media assets that were created to help, as some of the information that Shadik was sharing, to really help in the journey of making sure that you have the right assets to be able to build your social media presence, to have assets available for some of the digital advertising that we had mentioned earlier today. And the beauty of this is, for NeuroStar partners, they have the ability to come in anytime they'd like, download assets, print different assets, but also the site will continuously be refreshed. So I'm going to dive in a little bit and show some more information, or take you through how how the site's set up to be used. So you'll see at the top, there's a headline at the top that you can go into different areas of the site and see things like the marketing guide, ways to connect with your patients, connect with other physicians by referrals, advertising, digital and social media, as well as if you need some help with the site. So we have the different assets bucketed different ways depending on how you would like to use them. Or if if you're logging into myneurostar.com and a partner would already know, a NeuroStar partner would already know that they are ready to do some in-office posters, they could scroll down and click right on the in-office posters and get right where they need to go. So and also, as you scroll down a little further, you can see you can either click the need help, or there's some more, there's 2 different ways to contact if you need some assistance, as well as a little bit more information on how to use the site via a short video. But I think I'd like to dive in and really show you what the benefits of the site are so that you can see how easy it is to use. So if you are looking for some more information on how to set your practice up, digitally set your practice up, or on how to purchase online ads, you can click into the marketing guide section and scroll down. Some of the information that we shared today is captured here to help you easily get your Facebook ads ready to go, set up, and get your campaign going. How to use AdWords. All of that information is captured here under the marketing guide. And as I said, the creative will be refreshed. There are plans to actually refresh this section as well to continuously add information so that, again, we can find ways to help your digital work just as hard as you're working for your patients. So coming back to the home page, you can see what those assets look like. I mentioned the Boxer Girl or Dark to Light. These are the type of assets that you would be able to create. And as you can see, you can put your practice logo on here, as well as your practice information, so that you could easily make these assets and then use them, whether it be on Facebook, your digital ad presence, or if you'd like to make posters. That is all available to NeuroStar partners at any time, 24 hours a day, 7 days a week, to log into the site and be able to create their own assets.
Sure. So Google Analytics, again, is a free tool, and it measures traffic to your website. That's what it does. So in essence, you understand who's coming to your website, and once you know who's going to your website, you can see exactly what actions they're taking. So the value of Google Analytics is to be able to tell you where are people going to, where did people come from. And so if your entire marketing strategy is to set an appointment, which it probably should be because setting appointments leads to patients, then what we would recommend is having Google Analytics, because it will tell you exactly which media tactic is driving those appointments. So for instance, if you're running a Google search campaign and a Facebook campaign, and maybe if you have some banners out there in the marketplace, Google Analytics will tell you which one is driving those appointments and which ones are then becoming patients. So if you know that your investment in search is working and your investment in banners is not, well then where would you put your investment dollars? You would put them to search because it's working harder than the banners. So it becomes a very valuable tool. I think that sort of explains the value of Google Analytics and how to use it.
Register, the information that you have will be saved into the site. So as you go to create your assets, your information will be flowed into those assets. And if you have multiple offices, you'll be able to select which office you'd like to appear on a poster, on a banner ad. So that way when you're on myneurostar.com, setting up that registration helps to customize the site for you, so you're not having to re-enter or take additional time to set up materials. I think a great add to that question is the creative that you see today, as time goes on, will be refreshed. So what you're signing in, or what you're registering for and signing up to see today will be changing, we'll be adding to it. We know that when you're doing some digital banners online or Facebook ads, you want to make sure you're continuously refreshing that content based on some of the information that Shattuck shared of what's working and the information to help your practice, drive awareness for your practice.
Let me jump in on that, Karen. I think that's a great point because we continuously test the ads and we know which banners, which Facebook posts, we know which ad units are performing the strongest. And NeuroStar continually develops new advertising programs. So what all the partners get is the best of the best assets that then you can pull off of the website, of the mini site, and then you can use those, as Karen had showed you, for your own purposes. So all of these assets that are in there are free, and as you deploy your own marketing tactics, please pull them off of the website and use these particular assets because they're already proven winners and we know which ones work better than the others. And so we're only putting the best assets into MyNeuroStar.
To relive the page, the myneurostar.com does have a brochure on there, so you'll be able to order yours, but you'll also be able to customize and print. So we're going to try to take another run through myneurostar.com. This is perfect. So as you can see on your screen, the creative is now showing up. So as we're looking at the advertising section, and we talked about the patient support, and we were just talking about brochures, I'm going to go down and actually create a brochure. So you can see, if you go to myneurostar.com, now you can see all the creative for the posters, the patient brochure here that we just had the question about. If you'd like, you can go in and have, once you register and put all of your contact information in, my contact information is in here now as DID agency, and that's my home base. It's automatically added in here, but say I'd like to edit it and say Karen Schaefer on here as the practice name. I can easily do that All of my other information is in here. Save changes, and then hit preview. And when I hit preview, you'll see an approved and not approved come up, as well as that bar that shows that the piece is being developed. And as you can see on your screen now, I'm sure you guys have all seen, or most of you have seen, the patient brochure that we have, but now the patient brochure is customized for me and for my office information. And I would most likely have a phone number on here too, maybe even an email address or my website. That way, I have all my information on here, so as the patient is leaving my office, if they wanted to log on and make another appointment, or if they needed to call me for something, there's a customizable piece. Now, if I would hit approve, then that piece will be created for me, and I'll be able to download it right to my desktop and then send it out to print. And before we go, I do want to show you, I'd like to take some time to show you the digital social media assets, because I think it's nice to have the print option here, but there's also the option to create assets right on your desktop that you could use for social. So in this case, you can see how many options. Not only are there different sizes, but you can see right here the 4 different sizes that are available, but there are multiple different designs available for you for different creative executions. So we just saw what we're calling the boxer girl. I think we'll try a different execution, and we'll call this one is called Preview Doors to Light. Hit this one. Oh, let me hit this one more time. There we go. So when we customize this banner, as you can see, the multiple sizes that are available, including a 300 by 50, which seems like a really small size, but for a smaller unit or for a mobile unit per se, that would be an option. The logo is here where you can add your logo, which you didn't see in the last one with the patient brochure due to the size. But in this case, I can actually pull my office logo in here and select whatever I would like the message to be on this particular banner. So if I would like my logo to be on here and then take action, call today, or if I'm using these banners to send people to my website, I can change it to visit us online, or even click here to learn more information and then send them to more information about me, about my practice. So with this one, I'm going to say visit us online, and I'm going to hit preview. And again, the approve or not approve would come up. And at this point, I'm going to say not approved. I'm going to say, you know what, I like that, but I looked at it and I thought to myself, I'm going to try a different banner execution. So that's just some ways to use the myneurostar.com site. And if you are a partner of NeuroStar's, like I said, you will be getting an email with the information so you can log on and register. If you'd like to see a short video as well about myneurostar.com, it is available on the site here, so you can log in, check out the video, different ideas of the ways to use the site. And then again, if you have any questions or any problems, the concierge service is available for you to either dial the 800 number listed or email in at contact@myneurostar.com.